Are you satisfied with your understanding of sustainability? If you are not, imagine a journey together, a pluralistic one, with academia, innovators, startups, NGOs, all looking for solutions to the greatest challenge of our time. My name is Samuel Tini, and this is the Sustainability Journey. Welcome to another episode. Today we are going to discuss the social side, the people side. We have discussed a lot about environment, but we don't have to forget communities, work, and especially women's rights. And we do it with someone that is leveraging technology with his startup to promote sexual reproductive health and well-being for adolescents and young people, especially in Africa. So I'm very pleased to welcome today Benoit Renard of TICO. Thank you so much, Bernard, to being here with us today.
Thank you, Samuel. Yes, it's funny that you describe us as a startup. I think we are now 10 years old. We're going to celebrate 10 years. I guess we are a startup leaning towards scale up.
Yeah, fantastic. I know, because of course we are all starting up and we are all moving, and we want to know a bit your story and how also your rebranding from Triggerize to TICO, and how also you leverage data, technology, and work. But of course, before of that, who is Renard? How you have become a change maker in this field?
Okay, so who am I? As you can hear with my accent, I'm originally from France. I landed in sub-Saharan Africa, in South Africa, 24 years ago. So I basically spent half of my life on this continent. And that's how it all started. I was supposed to go into business, and then I ended up meeting projects, especially community projects at the time in Soweto. And that's where I realized, that this is where my heart was. Rather than making money for some shareholders, I'd rather make an impact in communities. And the second one was that we can mix actually business practices, private sector practices, with the development world. And actually mixing the two would potentially bring some efficiencies. And I've been looking at this for the past 20 years in various capacities, various work, sometimes in the private sector, sometimes in NGOs. And then I learned about the public health aspect of the work, especially the work with young people in our regions, by working for a large American NGO 14 years ago called PSI. I worked for them in Eswatini and Mozambique. And this is where basically the trajectory that led me to TICO and Triggerize started. This is where I co-founded Triggerize 10 years ago. This is where we learned about the application of technology in communities that didn't have a lot of access to technology. And yes, that's where we are now, 10 years later.
Fantastic. And I really like what you say, bridging together the two worlds, that sometimes they are at odds and they cannot talk. And so I really like how you leverage the two parts, the private sector, the development, and the work. And I want to understand, especially for our audience, what is TICO and how do you focus? I mean, what is your objectives and what is your mission, and why you have focused especially on the health of adolescents and young women?
So TICO, first of all, is a non-profit organization, even though you're going to hear me using a lot of business language because that's my matrix. That's how I was trained. We are non-profit. We don't have any shareholder. We work, our bottom line is impact. We work for the people we are trying to support. The second thing is that we are a tech NGO, a little bit like what you get, in the banking sector or in, the transportation sector. We've realized a few years ago that actually technology could become the matrix, could become the center, the core operating model of an organization. Obviously, we can see that again in other sectors. I mean, think Airbnb and so on. Look at NGOs. What if we were to do the same thing? So that's the first thing about TICO. We are a bit original. Our work is a public health work. We are in the communities. We work with community-based organizations. We deliver actual impact on the ground, but at the heart of it, it's a software managing all of this. And we believe that this software can bring efficiencies, can make us more effective, and can also connect the various partners on the ground. And that's the second piece of TICO, which is that this software and our teams on the ground work with local partners, very small scale private sector clinics, public sector clinics, pharmacies, community-based organizations. We enroll them, we allow them to work within our platform. They get an app, they can perform some activities, they can be paid for those activities, and they can mainly interact with an end user to whom we're going to channel some subsidies, we're going to channel some offers, some vouchers for product, and therefore trigger some behavior change and some impact. That's the foundation of TICO. Maybe a small thing, Samuel, because you've already mentioned the two names. 10 years ago, when we started this whole adventure, the other co-founder and myself, we created two brands. We created a brand which we thought was the brand we would use for our external communication, for fundraising, and that was Triggerize. And then on the ground, we created a brand called TICO, which was the brand our members, our users on the ground were relating to. TICO is a very warm brand. It's a wellness brand. We've made sure that this brand was not stigmatized, even though a lot of the offers are around sexual health. We've made sure that the brand was way looser, if you want, to make sure that nobody would feel ashamed to be associated to the brand, obviously. Our clinics, our pharmacies have a little logo that says TICO accepted here, and that's our brand on the ground. And we realized a few years ago that having those two brands for a small organization like us was one too many. It created confusion, and in many ways, it also didn't pay tribute to the quality of our marketing work on the ground to make people enjoy the TICO brand, to make people actually adhere to the TICO principles. And that's why, a few months ago, we decided to switch off our officially corporate brand and turn TICO into the brand for everything. That's all.
Fantastic. And I want to go a bit deeper. Where do you work? Which is your approach? Which countries are you touching with your work? And how also you have, if you can give us some bit of insights in the tech part, so at least we understand a bit better.
We are an African NGO. We are headquartered in South Africa. We've got programs in 6 countries. Our largest program is in Kenya, followed by Ethiopia, Uganda, Burkina Faso, Zambia, and South Africa. We've got teams in quite a number of countries, including some European countries where some of our engineers are located and other colleagues. And the way you were talking about the technology, the way it works is that it's our own technology. We've decided to develop our own software. It's a software that does a lot of separate things that exist out there. It's a software that can provide payments. It's a software that can collect data, software that can trigger some messages, reminders. It's a software that powers loyalty points. So for every behavior that is witnessed in our platform, we can issue some loyalty points that then can be redeemed in a local shop. So the software also powers that redemption element. It's a software that also verifies the reality of those interactions. We've got a whole aspect of trust, and we even use some biometrics in certain parts of our program to make sure that who is supposed to use our app is really the person we train, and so on. So it's a multifaceted software. It's in fact a platform made of multiple softwares, each of them independent from each other. Most of them are developed by our own engineers because they are quite unique to our domain. Some of them are borrowed from an existing partner when the solution already exists and it's a cost-effective one. So we buy some services from Microsoft and from Amazon, for example, and from Salesforce. But this is peripheral. The heart of it remains a proprietary software, not because we want to make money out of it. It's a software which is made for good. It's been paid by donor money. So it's a software that is supposed to give back to the communities. The reason why we keep it under our control is also because we generate a lot of data that is fairly sensitive. Where we have data about the sexual health of some of our users, and some of our users are people who are deemed as being fairly vulnerable. Because of that, we need to be extremely careful and very responsible about the way we protect their data. We need to make sure that the users are always the owners of the data. And that's one of the reasons why we've wanted to always to keep this software under a certain level of scrutiny by our board and by our teams in order to make sure that the software at no stage creates more challenges in the community.
Fantastic. And before jumping to see how this is working in the community and how it's transforming lives, I want to stick a bit on this side. So for the people that we have discussed, they are discussed about impact and work. So you have mentioned that you mainly work, you are an NGO, I could say maybe we can create this and a tech NGO, maybe like fintech. Now we will NGO tech as a new category of study. But you are creating impact using data, using innovative financing model like outcome based financing. How you are using that to create, and in a way also create this private sector more system in the NGO world, which can be displaying data, using data for impact.
So the way we use the technology and apply these more innovative ways of working is fairly simple on the ground. From a user perspective, it's about becoming a member of a membership program. Think of Amazon Prime, for example. So our young lady in the community in Kisumu, I think where you are, Samuel. We've got a young person, 19 years old, who's becoming a member of TICO. This membership gives her access to multiple services. Those services could be around her mental health, around her menstrual hygiene, definitely around her family planning and HIV prevention. With this card, she gets a membership card, a real physical one. With this card, she can go to a participating clinic or pharmacy. The clinic can be public or private. So that's the first way we operate. We've got a very large network, almost like 700 clinics in Kenya, for example, that are part of our system. If a young woman shows up with a card, she's going to be accepted, she's going to be able to swipe it, and she will receive a service for free. So that's the first element of it. So if you compare to other approaches that are sometimes more vertically integrated, in our case, we are horizontally integrated. We work with a very, very large number of community-based organizations and clinics and pharmacies to make sure that this young woman will have a choice about where to go. So that's the first originality. And that's only possible because of the software. Because at that scale, if you were to use a traditional approach to train, to support, to monitor, to performance manage those various actors, you would sink your budget in actually supervision costs and travel costs. So technology gives you real-time insights about what works, what doesn't work, alerts you about the places where there may be an issue, tells you also about the places where things are doing very well, so that you can cross-correct the course of your action. We pay those various actors. We actually disburse funds to reimburse them for the value of the services that are provided. When a young mobilizer mobilizes and successfully refers somebody for any of the services that are proposed, they also get a little bit of a reward as well. Those pay-per-performance mechanisms are also a bit of a novelty in our world, making sure that people actually are rewarded for the quality and the quantity of the work is a foundational principle for TICO. This is also relatively new. I don't pay you for organizing a meeting, I pay you for the outcome that you've actually provided. And this is why we, as an organization, can be funded through the same way, because we measure the outcome, we look at the end goal, at what is busy created in the community, what will be actually the impact of this work in the community, and then we can link our own funding to these outcomes. And again, those outcomes are going to be measured automatically through our platform. Every time somebody swipes a card or sends us an SMS and gives us a piece of information about what just happened.
Fantastic, Benoit. It's really interesting, and it's also disruptive in a way. You have really mentioned properly the traditional way, moving, sending, community health people with papers, signing and things. We will explode budget if you have the numbers that you are having all over the country in Kenya and all over the African country you have mentioned. Before going to the stories that our people also and our listeners usually like, because we want also to see how the technology impact the bottom line, the grassroots. I want to ask, have you also think, as a matter of curiosity, to scale your work in other sectors rather than just health?
We are user-centric, and that's something I will insist on this several times, meaning that we have a core audience, and we believe we are on a mission basically to improve the lives of young people and especially young women. So all the services and all the offers that we could be channeling need to respond to needs, either expressed needs or unmet needs or needs that may not be visible to them for these young people. So if you want, if suddenly we were to be invited to perform something for a very different audience with a very different sector, that wouldn't fit our mission. Now, young people have multiple needs. They don't, first of all, they don't silo their needs. They don't start to think about, sexual health in the morning, and then at lunchtime, they think about education. Everything is mixed, obviously. And as we know, you were talking about stories, we know on the ground, those things can be interlinked. If a young girl cannot attend school because of her period, because she was not aware of even what having her period is about, it has an impact in terms of dignity, in terms of sexual health, and definitely in terms of education. So all those needs are mixed. So to respond to your question, Samuel, we see our future and we see the impact of our work in a much more holistic manner around the needs of those users. Yet, we are always start with the sexual health needs. And I can tell you basically the founding principle there is that the best way to describe it is that a young girl can dream of anything. She has the power to dream. Her life is in her hands. Even though she may be coming from a difficult background, she can access education. She is smart. She's definitely street smart. She goes to school. She has a lot of things for her. But if by any chance she falls pregnant at the age of 16, 17, 18, then those dreams are going to be much more difficult, basically, to fulfill. And that's why we believe that before we even start to talk about the rest, education, entrepreneurship, other types of training, nutrition, or starting your own business, before we get there, let's make sure that we cover the needs in terms of sexual health. Don't catch a disease that's gonna become a liability for the future. Don't fall pregnant. If you don't want to fall pregnant, don't fall pregnant before you're ready to do so. And that's why we start with it. I mean, I don't know if you saw, but the Nobel Prize for Economics this last year was given to Claudia Goldin, who actually based her entire research on that topic. The link between contraception and economic growth in countries, the economic impact of contraception. And that's exactly what we're talking about. It is contraception becomes this kind of shield that will ensure that your future will not be challenged. You're going to have other challenges, but that one needs to be covered in order to deploy more potential in the communities. And Claudia Goldin even managed to put a growth point to access to contraception. That's the beauty of that model.
Thank you, Benoit. It also records what we see every day. When we have, for example, environmental classes with schoolgirls, and then after maybe a term, you don't see any girl in class because, of course, there was some early pregnancies and problem, which as at the age 13, 14, 15, it will, of course, hinder, and it will be a problematic for the development. Of course, those ages are still for school and to realize the full development before deciding to create family or everything. So it's really something that is a base, and I've witnessed many times. And going on that, we want to know which are the story, if you can share something within 10 years that have touched Benoit art, that really you have seen behind the real-time data and all these tech sides. What is also make you spark and your art beat?
Let me tell you a few. I definitely have a few, and my colleagues have tons, obviously. I do remember a nurse in Kibera, Nairobi, in Kenya. Her name was Maria, and she was running one of those local clinics, 2 rooms, maybe 3, because there's a little maternity ward, alone in the clinic. And Mama Maria, who was not young anymore, had already given birth to a few generations in this community. And when we sat down with her, starting to explain what TICO could do, we were coming, technology, etc. We were not in front of the most tech-savvy person. We were in front of somebody who was really trying to make a difference in her community. She dedicated her life to this work. And she was telling us, and she was heartbroken, because she was telling us that she was feeling that there was one battle she was not winning, and that was the battle of teenage pregnancy and young women pregnancy or unwanted pregnancy. She was telling us, I can't face seeing these girls. I feel I've given birth to maybe just 16 years ago, which for me at my age is around the corner, is just yesterday. I can't stand seeing her now pregnant, feeling that she potentially didn't choose that and her life is going to be more difficult. And when we started to work with her and showed her, we've got this mechanism, it's not going to be too cumbersome, we're going to support your work, it's going to support the outcomes of your work. There was initially, she has seen the world, so she was a little bit suspicious about this whole thing. She's seen other projects coming in and promising the world. But over the month and over the years, she's become one of the strongest providers in this ecosystem. She is supporting, hundreds of girls every month to make sure that they access contraceptive, they access the method they want at the time they want. And if one day they want to be pregnant, at least it will be a choice. And they will not have to pay the consequences of something they didn't want. That's the first story. I mean, there's some beautiful stories about young women who've told us, if it hadn't been for TICO, yes, my life would be different. There's young girls who tell us, you need to help me beyond contraception. To your point, Samuel, yes, it's great. Now I'm not going to be, I will choose when I get pregnant. But what happens for the rest of my life? What's my hope in terms of education, in terms of job, and how can you help me, because I do have anemia, and mental health, especially as we are in societies post-COVID, is a real issue. I'm struggling at home, or my older sister is struggling. So these are stories that warm the heart, because we feel we've done a little bit, but yes, also tell us that we haven't done enough, and that we, TICO, but we with our partners should actually think on how to make a better world there. Maybe the last story, we are working in the public sector as well. You have nurses that are stretched. They are working long hours. This is one of the most difficult jobs you can imagine. Sometimes in certain of the communities, I'm thinking Ouagadougou, for example, in Burkina Faso, forget it. There's no electricity. It's like sketchily powered by solar power. There's no air conditioning. The days are long and the work is hard. So the support we provide there is, again, to make it a bit easier, to give them also a sense of their performance. Just having a little digital system, very easy to use on a phone, that's going to give you every day an idea of how much work you've done, how many people did you see. Maybe after a week, you can actually sit down and say, okay, I did achieve something this week. When you're in the dark and when you're in the trenches doing the hard work, you don't realize how much you have worked. Just having a bit of feedback on your activity sometimes gives you the extra motivation to come back on Monday and carry on this hard work. Yeah, these are a few stories, Samuel, but we've got tons. Again,
I can imagine in 10 years in so many countries, but really give a sense and give also a sense of purpose of what you do, also for you, rather than sometimes the arid call for proposal and outcomes and indicators and all sort of this. But when you meet stories like Maria and the other that you have mentioned, of course, then you can see how you are really transforming lives. And especially this is also the question a bit, talking about the NGOs and this world that in Africa has also come under criticism. They see many years, some impacts and their work. So you wanted also to disrupt a bit the NGO started using technology. How do you see also this trend advancing, and how you see also the technology getting more and more getting insights there, this NGO sector?
We started originally with this assumption that yes, technology will manage to bring some disruption to this sector, some welcome disruption to this sector, the same way it has done it in other sectors. So as I mentioned, you take communication, transport, accommodation, there's lots of sectors we all know, we all now use almost fluently that 10 years ago were not even born as an idea. So why not in the NGO sector? And that's the first thing, is that why would we do that? We believe that we are also in a context where there's money is not actually going to increase dramatically. Donors and governments are actually extremely careful about the spending. Post-COVID, we are, being in the north or in the south, we are with economies that are struggling. So the first thing is that efficiency, and cost efficiency in particular, is, should be a North Star for all of us in the NGO sector. We should all be obsessed with how we use very scarce resources, and how do we make sure that we make every single euro or dollar stretch even further. So that's the first assumption. What if technology was to help us do so? What if technology was to relieve us from some fixed costs that are inherent? What if suddenly the ability to receive, for example, real-time data was allowing you to stop something that seems to be actually costly and not very effective rather earlier than later? In the past, we've all worked, again, as I told you, I've worked in this sector for almost 20 years now. Sometimes we were waiting for a 6 months report to realize that, yes, this activity was a complete disaster and didn't do anything, except that now 6 months is 6 months of costs, of salaries, of travel, of meetings and workshops. If you get the data in real time, you can stop it after day one, after week one. And that changes completely the way you operate, which means that the disruption is also in the way NGOs work. Log frames are amazing, and we all need to actually be very, very careful in the way we describe our activities. But at the end of the day, there's a lot of value in being agile, in actually learning very regularly about what's happening, again, what works, what doesn't work, and repackage your work and change the course of your program in order to hit your targets, in order to deliver the impact you've committed to deliver. So this mindset about outcome delivery rather than working around activities is key. And again, thanks to technology, we can now do that. In the past, we had no idea. There's a saying that says half of your budgets are going to be wasted. You just don't know which half it's going to be. With technology, when you track every single of your activity, when you can attribute the impact of an activity to a certain outcome, then suddenly you know which half is working and which one is not working. And that's where you can optimize that half of your budget that doesn't seem to be delivering correctly. There's more things around technology. I mean, obviously, the growth of our populations in our countries is going to be phenomenal in the next 20 years, especially the growth of the teenage population. The world is going to see the largest cohort of teenagers it's ever seen. And these teenagers are not even born yet, as of today. So we're going to need to be able to respond to the growing needs of this population. This population is more likely to be tech savvy, more likely to be connected. So here there is a challenge for technology. How do we make sure that the messaging is right, that we fight against fake news, that we avoid actually the dark side of technology? But on the other hand, we also need actors around, those ecosystem of partners that are going to support this growing population. We can't just rely on one sector. The private sector can't do it on its own. The public sector can't do it on its own. We need to task shift. We need to work at a more community level, at a more granular level. We've seen it during COVID. Things like community health workers in our countries are an incredible strength for our countries. In many, many ways, the ability to go door to door, promote certain behaviors, deliver certain products, is something we have in our countries that we need to actually expand, except that if you want to expand it at the scale that the population is growing, you're going to have an issue in terms of logistics training or even in terms of budget. I go back to that point. If suddenly everybody is equipped with a phone, maybe the training can be done online, maybe there can be a reading aid that can be tailored to this very situation that this mobilizer is having, can be assisted basically in doing a better job. Not to mention that the assistance you can have in terms of diagnosis and screening, recommendations to the end users based on learnings we've had. So the whole, artificial intelligence element behind that, the machine learning element, all of this is going to be an incredible opportunity in the future.
And thank you so much. And I would add to this that also the Byzantine and cumbersome bureaucratic procedures of many donors should also align. That's why I like, and I describe you a bit as a startup, because you are made agile and work your way, really, rather than mimicking sometimes the bureaucratic and elephants heavy public sector's traditional. So this is also important that some NGOs and projects, they have to follow. So this is also something, I think, a mindset change that the sector, and with the help of technology, can go. One of the questions that was in my mind as well was, you are working in a sector, and especially in an area which is highly sensitive. For some countries, some cultural barriers, social barriers, and different contexts can be a bit problematic. So you're working in several countries in Africa. So how do you ensure consistency and effectiveness of your program, and how do you also overcome some of the barriers that can hinder your drive for impact?
One of the cornerstones of our approach is local partnership. As I mentioned, we work with community-based organizations, local providers, local pharmacies, public sector. We try to be to work in line with the local programs, the local governments. And because of this, and because of our teams on the ground, we listen. So that's the first thing. Being user-centric means to listen and not to come in with a solution that would have been created somewhere, in France, in Italy, or in San Francisco. So that's the first thing. The best way to make sure that whatever you are trying to do is going to be relevant, is going to actually respond to the needs, but also, being cognizant of the local challenges that they can be, being in terms of tradition, in terms of mindset, or in terms of actually logistical realities. You need to listen. You need to have a foot on the ground. You need to be very close to your users. And it's not a one-off exercise. And again, that's where technology can help. It's an ongoing exercise. Being user-centric, applying user-centered design principles means that it's an ongoing process. You start, you test, you potentially do some A/B testing, you learn, you refine, you listen. And if by any chance at one stage what was working last year doesn't work now, it means something has shifted. You need to listen as well. And that's how the relevance comes in. So local partners, you work with community-based organizations. These are amazing organizations. You were asking me what makes my heart warmer. When I sit down, like I did in July last year in Ouagadougou in Burkina Faso, with a few community-based organizations that have dedicated their work in a challenging environment to supporting their peers and to supporting their communities. These are the people doing the hardest job. They know better than all of us what will work in their community. They take the pulse of what's happening out there. Again, we are here to emphasize their work, to give it visibility, to potentially fund it, to support it, but we are not there to dictate what they're supposed to do. They know better the how. What's important is that we align on the end goal. Why are we doing all of this? What are we trying to achieve? The how, they should have the possibility to do it themselves. We work with counselors. They know, they can sense actually the person who's in front of them. So a counselor who's very well trained, very well accepted in the community is going to be an amazing asset in the program. Again, we are not in the business of replacing them. And I'm insisting on this because even as we talk about technology, there's lots of trends and fashions and in the technology sector. And one of them has been around, making everything virtual. For example, what if, you were to encounter a doctor who would be a robot, and then a counselor would be a robot as well, and everything would be delivered without human beings. The reality is that when you talk about topics such as sexual health, the human being remains extremely important. There's nothing better than a big sister to tell you in your words, in her words, what she thinks, what to do, or a few recommendations about behaviors and how to say no to those boys, and etc., etc. So that's also what we need to recognize. And again, rather than applying something that would have been designed in a software or in a university, let's understand that human element is key.
And this is a very powerful statement because, of course, we all read books where by 2040, 2050, we'll have all virtual doctors, virtual teachers, disruption, but of course, the human touch and the behavioral change, it's still, especially for sensitive topic like those one, better develop and discuss, and especially when you decide with your body and your choices by another human being. And that will be, I think, still relevant and is relevant. I think we will come to discuss with you hours and hours, because I really like and enjoy your episode, because it's such a holistic one, and I really like how you leverage technology and innovation, which has been a topic of our podcast, for the social well-being and solving real and tackling real problems. And it's usually people that are some audience then say, oh wow, we have learned so much, we have done a wonderful job, Benoit, but what I can get, how we can also do some impactful work in my field, how can I become a change maker? And this is also something that I've worked 20 years in Africa, like you, and you have been working in this sector so many times. So we want to hear a bit from your wise experience, what you can give us.
I like the comment on the wise experience. I mean, the first thing would be, do listen to me, but do listen to 100 other entrepreneurs or social entrepreneurs, of people who have made the work, because you will get your inspiration from the hundreds of them, not from one person. So I'm going to give my bit, and that can influence. The first recommendation, which you've heard just now and I've repeated, is the user centricity and the localness. Especially in the kind of development aid, in the NGO sector, the future is local. It's the world where you would have, French doctors flying in and delivering bags of rice is over. Whether it was a good thing or not is another debate made for books and PhDs. We just know that in the future it's going to change. So, international NGOs are going to have to completely rethink the way they operate. Local NGOs are going to be way more empowered. And in that context, if you want to be a change maker, do take that in consideration. Local, and being user-centric. Again, avoid taking yourself as the target audience because you had that experience when you were young doesn't mean anything on the ground. Even if you come from the country where your program is supposed to be applied, you are different from your audience just for one reason: it's a new generation. Teenagers change. We've seen that in the past 10 years of TICO, and a little bit more before we started officially as Triggerized TICO. We've had already 3 cohorts of teenagers working with us. They're all different from each other. What was working 10 years ago, let me give you an example. We used to send SMSs as a reminder to our users to tell them about the next offer, to remind them about the next appointment. 10 years ago, people loved those SMSs. They felt, for the first time, somebody is asking me my opinion about something. For the first time, I'm getting this official, program talking to me, young person in this community, and where I feel a little bit disempowered. 10 years later, an SMS is a spam. Nobody wants another SMS. It's over. So again, don't apply your own thinking. Listen, be user-centric, and be local. The second point I would say is, and that's a very personal opinion, try to fight solutionism. There's an app for that, or there's an AI for that. Let's come up with another tool and another solution. Tools are only as good as the way you use them. And as we know, some tools can backfire as well. So think again in terms of user needs, think in terms of outcomes and impact, and then look at what tools and solutions may exist out there or may need to be invented to respond to those. But if your passion is in trying to apply a tool that you've been dreaming about wherever you can, you may find a little bit of a challenge at one stage. You're going to try, it's the hammer looking for a nail. There's a moment where it may be difficult. So I would invite you, even though your idea may be brilliant, again, test it very quickly on the ground and try to assume and try to be open-minded. Maybe your tool was not so good. Maybe accept the failure on this one. We've had at TICO, we've had hundreds of ideas that never made it. And even now, as we speak, we have an innovation practice testing 10 tracks of innovation on the ground in Kenya. We know that some of them, even though I believe they're brilliant, we had amazing ideas, amazing insights. I'm pretty sure that 30% of them are never going to make it. It's going to fall flat. It's not the right approach, or maybe TICO is not the right organization to apply this approach or to promote this solution. So second thing, avoid solutionism. Again, be user-centric. And the last one, please think big. Enough of pilots, enough of little things, enough of like 10 people helped here and there. Again, the scale of our populations and the growth of our population, the growth of the needs, the fact, as you pointed out, Samuel, all of the challenges out there being, conflicts and generational challenges, environmental consequences, I mean, the climate change and all the environmental crises, plus the health crisis, plus the next pandemics that we don't know about yet, but that may come back. All of those challenges mean that you need to think big. We cannot afford at the moment to think small and just pilot this. Go beyond the pilot, test things out, but think big from the get-go, from the beginning.
Fantastic. This is a lesson also, as I say, on entrepreneurship and how to work rather than NGO work. So I want really to thank you so much, Benoit, for this wonderful episode. You have spun and you have given us a really disruptive lesson and also food for thoughts on how we can improve a sector, which is critical and will still remain critical for some years ahead, but it needs to be changed and it needs impact. And you say impact and scale. Those, I think, the word that I will take with me and have working. Thank you so much, Benoit. It's been an honor and pleasure having you on the journey.
Thank you, Samuel. Thanks all.
Are you satisfied after this wonderful episode? Let's continue together our sustainability journey.